talk about social health. Social health is the ability to form and maintain meaningful relationships with others, interact effectively in social environments, and have supportive network of friends, family, and community. Social health, it involves communication skills, emotional intelligence, and a sense of belonging, which contributes to overall well-being. Good social health, it helps reduce stress, it enhances mental and physical health, and it improves the quality of life. Imagine doing everything right to take care of our health, eating nutritious food, exercising daily, practicing mindfulness, and even seeking therapy when needed. We do everything the experts say it will help us to stay strong, both physically and mentally. But something still feels off. We lie awake at night, restless. We wake up in the morning feeling drained. We struggle to focus during the day. We wonder why, despite all our efforts, we don't feel like our best. We are not alone. There is something missing, something often overlooked, but just as important as physical and mental well-being. The missing thing is social health. Many of us live under an illusion, a false belief that needs to be broken. We assume that only what we physically consume, like our diet, our habits, they affect our biochemistry. But this is not. Science has shown that our external environment, especially our social world, it plays as significant as a role in shaping our health, emotions, and even our learning. Humans are deeply social beings. Throughout history and across all cultures, we have thrived in connections with one another. From the moment we are born, we are wired for relationships. A baby's survival, it depends entirely on the love, care, and response of others. A parent's brain is flooded with a pleasure when they smell their baby's head, and they are filled with distress when their baby cries. This is not a coincidence. This is biology. We are designed to connect, to depend on one another, and to find safety in relationship. Social health is about connection. Social health is about relationships, and it is about belonging. It is about having people in our lives who support us, who listens to us, and who simply sharing lives experiences with us. It is the missing piece of the puzzle that so many people do not realize they need. And without it, our other efforts to be healthy, they fall short. In today's world, millions of people go weeks, even months without meaningful interaction with friends, family, or community. 1 in 4 people, they feel lonely. 1 in 5 adults, they feel they have no one they can reach out for support. This is more than just an emotional struggle. It is a public health crisis. Loneliness does not just affect the heart, it affects the body. It weakens the immune system. It increases the risk of heart diseases and stroke, dementia, and depression. It shortens lifespan. Just as smoking once was a silent killer before public health campaigns exposed its dangers, in the same way, loneliness is quietly and equally harming millions every day, just like smoking. But there is a way forward. We often focus on what we eat, how much we exercise, or whether we avoid harmful substances. But how often do we think about the quality of our relationships? The people we surround ourselves with, the interactions we have daily, and the way we feel in social spaces. They all affect us just as much as the food we eat or the air we breathe. And this need for connection, and this need for connection does not fade as we grow older. Our bodies continue to react to our social world every single day. When we feel loved, valued, and connected, we are rewarded with feel-good hormones like oxytocin, dopamine, serotonin, and endorphin. These chemicals, they make us feel safe, joyful, and at peace. They are our body's natural medicine, reducing stress and even physical pain. But when we feel isolated, when we are disconnected, or when we are excluded, the opposite happens. The opposite happens. Our bodies flood with stress hormones. We experience anxiety, we experience sadness, and even physical pain. So, what do we do about this? How do we check in on our social health? We measure our physical health with the scales and the tests, but what about our social well-being? There has never been a simple way to assess it until now. Let's start with two simple questions. How many close friends do we have? Not just acquaintances, not just people who like our posts online, Facebook, Instagram, but real friends. The ones who would be there in times of crisis, who know our deepest dreams, and who love us anyway. And how do we feel about the depth of those friendships? Are they fulfilling? Are they supportive? Are they meaningful? By putting together the number of our relationships and the quality of those connections, we can determine our social health score. And where we fall on this scale matters. If we have strong and fulfilling relationships, we are in the green zone. This means we have a solid support system. And if life knocks us down, there will be people to catch us. If we are in the yellow zone, our social health is at risk. We might have many acquaintances, but lack deep bonds. Or we may have close friends, but not enough of them to form a strong safety net. And if we are in the red zone, we must take immediate action because loneliness and isolation are not just painful, they are very dangerous. Improving our relationship is not something we can afford to put off. It will not get easier with time. We must act now. But how? Here are three simple yet powerful steps to move toward better social health. First, we all need at least one emotional support human. One person who reminds us of our worth, who sees the best in us even when we cannot. Who is that person in our life? And are we that person for someone else? If we do not have that person, we need to find them. We need to find them. If we do, we must nurture that bond. Second, we must pay attention to how we feel around others. Our bodies give us signals. Do we feel joy? Do we feel ease? Or do we feel drained or anxious? Relationship should add to our happiness, not take from it. If someone makes us feel safe and valued, we should invest in that relationship. If they bring negativity and stress, we must set boundaries to protect our well-being. Finally, we become like the people we surround ourselves with. Our habits, beliefs, and even our level of happiness, they are influenced by those closest to us. So, we must ask ourselves, are the people around us the kind of people we want to become? If not, it may be the time to seek out those who inspire and uplift us. Doctors tell us to eat well and exercise for physical health. And they are right. But social health is just as critical. A strong, positive social life is not a luxury. It is a necessity. It affects not only how happy we are, but also how long we live and how well we thrive. So let's take responsibility for our social health. Let's check in on it regularly, nurture our friendships, seek meaningful connections, and build a network of support and joy. To be truly healthy, we must prioritize our social health. We must be intentional. We must be intentional about our connections, just as we are with our diet and exercise. And one simple way is we have to interact with 5 different people each week. We have to strengthen at least 3 close relationships. We have to spend 1 hour each day in meaningful connection. These small but powerful steps, they can transform our lives. They can transform our lives. Think about it. When was the last time we made eye contact with a stranger and exchanged a genuine smile? Research shows that even small interactions, chatting with a barista, greeting a neighbor, they boost happiness and they create a sense of belonging. Think about the 3 people in our lives who matter most to us. Have we checked in on them? Have we made time to sit down and truly listen? Relationships, they do not thrive by accident. They require care and they require effort. The same way we schedule work, meeting and doctor's appointments, we must schedule time for our loved ones. Send a message, make a call, show up. 1 hour dedicated to meaningful connection, whether it's dinner with family, a walk with a friend, or even just a heartfelt conversation. It does not have to be extravagant. It just has to be emotional. This is not just about individual well-being. It is about shaping a future where social health is as valued as physical and mental health. A future where children learn about connection in schools, where cities are designed with spaces that bring people together, where no one feels alone in their struggle. There was a time when mental health was rarely spoken about. Today it is widely acknowledged. Today it is widely supported and it is widely prioritized. The same can happen for social health. So let's talk now, be proactive, reach out, connect. Because when we strengthen our social health, we are not just improving our own lives, we are lifting up the lives of everyone around us. And that is the foundation of a healthier, happier world. Imagine if we could choose our own families before we were born. Imagine if we could decide where we would live, how much money our parents made, what kind of education they had, and what opportunities we would have. If given that power, what choices would we make? Because these things matter. They determine the quality of our lives, our health, and even how long we will live. But we do not get to choose. We are born into circumstances beyond our control. And for many, these circumstances come with struggles. Some are born into families that fight every day to survive. Some are grown up in communities where opportunities are scarce, where education is underfunded, and where healthcare is hard to access. These are not just personal challenges, they are reflections. They are reflections of a society that has built walls instead of bridges. One of the greatest myths about health is that it is only about hospitals and doctors. Health is so much more. It is about the air. It is about the air we breathe, the water we drink, the food we eat, and the homes we live in. It is about the schools that shape our minds, the jobs that provide security, and the communities that either uplift us or they break us down. These factors, they called social determinants. They called social determinants of health. They are the true foundations of well-being, and yet they are not equal for everyone. Some communities thrive while others are left behind. History has drawn lines between us, separating people by race, income, and location. Some neighborhoods, they have the best schools, the cleanest streets, and access to fresh food. Others struggle with the poor education, pollution, and a lack of healthcare facilities. These differences are not accidental. They were created by policies and decisions made long ago. Decisions that still affect millions today. The truth is, the color of our skin, the income of our parents, and the zip code we are born into, they should not decide our destiny. But too often they do. We have seen it in history, and we saw it again with COVID-19. The pandemic did not affect everyone equally. It hit the most vulnerable the hardest. Those who already have the health conditions, those living in overcrowded housing, those working in low-paying jobs without benefits. It exposed the deep cracks in our society and reminded us that health is not just about personal choices. It is about the systems that support our failures. And change is possible. We do not have to accept this reality as permanent. We can make a difference, not just for ourselves, but for future generations. It starts with the awareness. It starts with challenging the assumptions we have about others. It starts with recognizing that we are all connected, that we are not separate group of people living different lives, but one community that must rise together. We must become advocates for change. We must break the barriers that keep opportunity from reaching everyone. We must support policies that bring healthcare to every neighborhood, education to every child, and fair wages to every worker. And beyond policies, we must show up for each other. We must reach out to those who have been overlooked. We must mentor, we must guide, and we must uplift. Because the only way to heal a broken system is to stand together and refuse to let inequality define us. No one chooses to struggle. No one chooses to be born into hardship. But together, we can choose to create a world where no one is left behind. We can choose to build a society where health is not a privilege, but a right. We can choose to be the change that transforms lives, not just for us, but for everyone. Because when we uplift others, we uplift ourselves. When we heal the wounds of injustice, we heal our world. And when we stand together, nothing is impossible. In conclusion, both social health and social determinants, they play a crucial role in shaping healthcare outcomes. Social health, which reflects the quality of relationships and community connections, it impacts mental and physical well-being, while social determinants like income, caste, region, education, and their access to resources, they influence healthcare access and they influence quality. Recognizing and addressing both aspects, it is essential for building a more equitable and effective healthcare system.